over the 40, I guess it's miles.
Good evening, everyone. Good evening. Thank you for coming out in this chilly, chilly evening. Greetings from the office of the Brooklyn Borough President Antonio Reynoso. Very good. So, we're going to get right into the program. And the first person to come up will be Councilman Lincoln Ressler, who's the councilman for this district, which is District 33. Councilman.
Thank you so much. Well, I firstly just want to thank Borough President Reynoso. He got a demotion back to when he was a council member. Borough President Antonio Reynoso, who has been just doing a phenomenal job since he arrived at Borough Hall last year. He is full of energy and dynamic progressive values, and he always centers the people in our community who are most in need. And I'm so excited to be a co-host and supporter of this event, and I really want to thank the Mayor's Office for People with Disabilities for their great work and for helping to convene us tonight and convene many of our great community-based organizations. You know, my commitment to each of you is to folks with disabilities across our communities is to provide support in every way we can for people to live their absolutely fullest and most dynamic lives, for us to make our streets safer so that people can get around, for us to improve Access-a-Ride so people's transport is reliable, for us to ensure that housing is accessible, and frankly we need a whole lot more of it and a whole lot more affordable housing, but it needs to be accessible. And we need to make sure that our schools are providing opportunities for people with all different kinds of learning experiences and abilities. We have a long way to go to realize a much more just community and society, but when we're centering the needs of people with disabilities, we are going to be making a whole lot of progress to achieving more social justice in our communities. So I hope that tonight is a fruitful and dynamic evening and an opportunity to connect to services and supports, and I really want to thank everybody, especially Borough President Reynoso, who's really doing a phenomenal job for helping to bring us all together. So thank you so much. Thank you.
Next, we have our hosts will say a few words. The Independence Care Systems. This is Lauren, am I saying it right? Looney.
Nobody forgets the Looney part.
Looney. Lauren Looney. Here you go.
Thank you so much. I appreciate it. Welcome everybody to Independence Care System. We're so happy to have you with us tonight. Thank you for clapping. We appreciate that. So, Independence Care System is the first and only health home dedicated to the needs of people with physical disabilities. We have about 2,500 members in 5 boroughs of New York. We recently expanded to Staten Island, and we're also expanding to Westchester and Orange counties. Our job is to help our members to live as independently as possible. We have a couple of unique programs. We have a wheelchair evaluation program called On a Roll. We also do wheelchair repairs. If you have folks out there who are looking for wheelchair repairs, we're happy to speak with you. And really, we have a social program for people with disabilities. We help people with physical disabilities to get mammograms and to get primary care. Healthcare is what we do, and keeping people independent in the community is how we roll. Somebody just told me that the other day. I'm going to use it. Thank you all for coming. Welcome, and if you'd like information about ICS, I'm happy to provide it. So thank you very much to the Borough President for getting us all together, and welcome to ICS. We're happy to have you.
Very good. We have a few representatives from other elected offices here to say a few words. I believe I have someone from Congressmember Dan Goldman's office here. Is that Jack? Am I right? Very good. Come on up.
Good evening. It's good to be here. My name is Jack Pleshnik, and I am here on behalf of Congressmember Dan Goldman. Congressman Dan Goldman represents the community of Northern Brooklyn, the communities of Northern Brooklyn, communities of Lower Manhattan, and he has been a proud and very, very vocal advocate for the disability community. We were very pleased to be able to join arm in arm, hand in hand, with our Borough President of Brooklyn, Borough President Antonio Reynoso, who has also been an incredible partner on many issues, but especially on this incredibly important issue when it comes to serving the disability community. The Congress member, in making sure that we can serve those with disabilities, made it a priority on his legislative side to make sure we have appropriate bills that he can support, that he can get behind, and that he introduced that supports the disability community, not only those with physical disabilities, but those with mental disabilities. So Congressmember Goldman, just this last summer, introduced a bill in conjunction with our Senator Kirsten Gillibrand. The bill is called Strengthening Medicaid for Serious Mental Illness Act. This is a bill, an act, that will provide essential funding into the Medicaid system to provide health care for those that need mental health services that normally would not be able to get those mental health services currently through Medicaid. Our office is always open for anyone that might need any help. You could always come to us, you could always contact us. We'll always be there. Both our office in Manhattan and over here in Brooklyn are ADA compliant, so you're always welcome to come in and say hi. Before I finish, I just also want to express a big thank you to the host, Independence Care System, who generously offered their space and helped arrange this in conjunction with the Borough President's Office. And of course, I also want to acknowledge and thank the other co-sponsors, other elected officials, the Mayor's Office for Peoples with Disabilities, Senator Granados' office, Assemblymember Joanne Simon's office, Councilmember Lincoln Ressler, and of course, the Borough President. Thank you very much. Have a wonderful evening. And of course, if you need anything, we are here. Thank you.
Is Allison still here? Ah, very good. From Assemblymember Joanne Simon's office, Allison Mingus.
Hi, good evening, everyone. My name's Allison. I'm here representing Assemblymember Joanne Simon. She represents this district where we all are now. Thank you to the Borough President's Office and for everyone being here. For those of you who don't know, Assemblymember Joanne Simon is a disability civil rights attorney, and she's also a former teacher of deaf students. So we welcome everyone here to come to our office, call our office. We are here for you if you need help accessing services, if you need help navigating really difficult and opaque state agencies. We are here for you, so please reach out anytime. Thank you.
Very good. So we have several organizations here this evening. Each of them will come up and tell you briefly about their services. I'm going to introduce them one by one as I say the name. Someone from that organization, please do come up. So the first one, a representative from AHRC NYC, please do come up.
Okay, sure. Hi, everyone. My name is Hernan Amorini. I work at the Referral and Information Center at AHRC. AHRC is an agency that helps individuals who have developmental and intellectual disabilities. It was founded in 1949 when a group of disgruntled parents got together and said, look, we need to have services for this population. In New York, there wasn't any services at that point, and so we became the first agency to provide those services. And we're also one of the biggest agencies providing services for people with intellectual and developmental disabilities. We provide a variety of services. We have preschools, middle schools, elementary schools, and a high school here in Brooklyn. We also provide a college program, so for people who graduate. We have home care services such as in-home respite and community hub. We have adult day services for people who graduate high school. So we do site-based day hub programs. We have day hub without walls. We also have employment and business training. So we train people and place them at different jobs throughout the city. Also, we have recreational services for children and adults. We have after-school programs. We have Saturday and Sunday recreation programs. We have camps, beautiful camps upstate. And also, we provide clinical services. So for a lot of these services, people need to be eligible for with OPWD, the Office of People with Developmental Disabilities. So if you need evaluations, we can provide them. We can also provide therapy, like psychotherapy, counseling. We provide psychiatric services. Also, we provide a number of other services such as guardianship, educational advocacy, family reimbursement, and I think that's pretty much it. Residential services too, for adults. So if an adult needs a residence, we have apartments and homes where they can attend, where they can live. So yeah, that's pretty much the services that HRC offers at a glance. We're over there, and if you have, yeah, there we go. If you have any questions, you can always come by the table that we have.
Do you service just Brooklyn or?
No, the 5 boroughs, yeah. Actually, HRC NYC is the New York City agency, but we are actually in the whole country as ARC. So yeah, thank you very much. Thank you for allowing me to be here.
Thank you. And just so you know, it's my remiss for not explaining the program, but each organization will come up and they'll make an introduction of what their services are. Then we'll have the main presentation from MOPD, Mayor's Office for People with Disabilities. And then afterwards, there will be time for questions. All right. So the
I wanted to say one thing. This is staff here from AHRC, from the schools that are located here in Brooklyn, in case anybody has some questions.
Very good. Thank you. Thank you very much. The next organization up will be BCID, Brooklyn Center for Independence of the Disabled.
I'm Joe Rappaport. I'm here with my colleague Sandrina Kingston. We're going to do a little song and dance. I'm just kidding, actually. We're just going to talk very briefly about our organization, which is actually located on this floor as well here, next to ICS, but we share the space with them. We've been around also for a long time, since 1956, and we were also started by parents who were fed up with some of the mainstream organizations. We're now an independent living center, which is part of a worldwide movement of disability-led organizations that provide services and do advocacy for and by people with disabilities. We've been a leader on a lot of fronts, particularly to do with transportation. We were part of a lawsuit that went after the MTA about the lack of accessible stations, subway stations. We won that last year. We have other things that we still have to win from the MTA. We're also organized as part of something we call the Accessoride Reform Group, which is trying to improve accessoride service. The acronym for the Accessoride Reform Group is ARG, because that is because of very frustrating service. We do have an advocacy group that meets monthly called the Brooklyn Activists, what is it called? Brooklyn Advocates Network Group, because we wanted the acronym BANG. So we like acronyms. And if you sign up over at the table, we'll make sure that you get notices about that. That's not in person, that's online. And you can call in if you don't have a good computer access. And we also are starting, and Sandrina will talk a little bit about it, but we are starting, I want to really emphasize this more than once, a program called the Disability Warm Line, which will have limited hours at the beginning, but we'll be starting. You can call any time during the hours that we're open and talk to a peer, somebody who has been through things that you may have been through. They can offer just, an empathetic ear or guide you to resources. It's not a hotline unless if you have an emergency, we can deal with it, but it's a warm line just for you to get something off your chest or find out information. So that's starting actually next week. Sandrina, you want to talk a little bit about some of our other services?
Yes. Hi, Sandrina Kingston. I'm the program manager, and I want to get to the nitty-gritty of our services. We offer housing information. We assist with applying for benefits. Yes. We assist with applying for all types of benefits, Social Security, SNAP. We also have a transition program where we transition individuals from nursing homes to the community. We have a peer support group. And of course, like Joe said, we do all levels of advocacy. And during tax season, free, we have free tax preparation. And I want to boast a little bit more. The accessible pedestrian signals, the beep beep for the sidewalk, we were there from the beginning. We had an advocate there in that coalition, so we were part of doing a lot of work with that. And again, if you're disabled and feeling overwhelmed, call the warm line. And please come to our table. We have lots of information over there. Thank you.
Thank you.
Next up, we will have someone from Helen Keller Services for the Blind come up to the podium. Thank you.
Hi, everybody. My name is Katie Graham. I'm from Helen Keller Services. We are located actually right down the block, just about 2-minute walk from here. We've also been around for quite some time, well over 100 years. I've had a few names over that period of time, but we service people of all ages. Mostly, we service people who have a diagnosis of being legally blind. We service people with full range of vision loss, though. We start with an early intervention program. We have therapeutic programs for children with vision loss. We then have a children's learning center, which is preschool services for kids with vision loss, autism, multiple disabilities, or developmental disabilities. Beyond that, we work with, again, kids of 5+ in pre-vocational and transitional programs. We also have vocational rehabilitation programs that can include employment services, independent living skills, so things like learning how to cook, clean, travel in your communities. We offer social casework, things like getting connected with different community resources and adjusting to vision loss. We have assistive technology services, we have employment services, and we also have low vision services. So for all of those different services, we provide individual assessments with each client and then provide the individualized training plan with each of them. Depending on what the needs are, we may go to the home or we ask for clients to come to us depending on what those needs are. We do have our Brooklyn office located down the street, but we also service people in Long Island and all of the boroughs. And finally, we also have a program specific for senior citizens. Senior citizens who are legally blind can get the independent living services, so things like the in-home cooking, cleaning, traveling services, and low vision services as well. So, and I'll be to your right if you have any questions.
I'm hoping to have someone from ICL. Very good. Come forward, please.
Good evening, everyone. My name is Samantha Lawrence, and I'm from ICL, which is Institute for Community Living. We're located at 2581 Atlantic Avenue, which is 3 stops on the A train from here to Broadway Junction. So our hub provides several things. We have a clinic with CHN, which provides medical and behavioral health, appointments and services. We have pros for mental health services. Those are through referrals and acting if you have severe mental health diagnoses. We also have ICL Connects located at the hub for those who need assistance with rental or utilities, rental arrears. So if you have any payments in like gas, Con Edison that you're unable to pay, ICL Connects assists with that. I am the director for that program. We also have care coordination. Care coordination assists members who have medical and or behavioral health diagnoses. The care coordinators assist members with going to their appointments. We can take you to your appointments, schedule your appointments for you. If you need medical transportation, if you need someone to speak on your behalf to your provider, sometimes people feel that they are shy or they don't have a good relationship with their providers, your care coordinator can assist you with that. If you need assistance with getting your medication mailed to your home, we do that as well. If you need assistance with getting entitlements or benefits such as SNAP, Medicaid recertification, applying for Social Security, we do that as well. On Wednesdays, we also have a food pantry, which is open to the community. That is from 10 a.m. to 1 p.m. Anyone is welcome. And I will be at the location over there in the back. I also have a turkey drive on November 16th. So if you come over and leave your information, I'll put it in our raffle. Thank you for having me.
Perfect timing. The next organization to come up and speak will be the Metropolitan Transportation Authority, MTA.
Thank you, Christina. Wow, what a warm welcome. Hi, everyone. My name is Sarah Berry. I represent the MTA. I work specifically in the MTA Accessibility Office within the Department of the Chair. I know most of you guys probably know our services. Joe started us off. We provide accessorized services for customers with disabilities who are not able to access mass transit. We also offer reduced fare, which is half price for seniors and people with disabilities to ride on buses, subways, Long Island Railroad for half fare. There's a Fair Fares program that is with New York City. It's a city program that offers reduced fare pricing for low-income New Yorkers. And Fair Fares does apply to Accessoride, so you do get that Fair Fares half rate on Accessoride if you qualify for Fair Fares. As Joe mentioned, yes, we settled a lawsuit last year, which we have made a commitment for 95% accessibility across all of our subway systems by 2055, so that is about 30 years. But it also equates to making more than 300 additional stations accessible. So right now we have 140 accessible stations out of 493 stations. So we have a ways to go, about 29%. And we have, through the 2024 and through 2029 capital plan, we invested $5.5 billion into accessibility, which calls for making 70 stations accessible within the 5 years, which is the largest investment that we had ever made. And now with this additional settlement, we'll be making similar investments between 70 and 80 stations every 5 years. The goal is to have, cheaper, faster access, right? One way that we're looking at it is to be able to eliminate elevator maintenance issues that we're having by creating street-to-platform elevators to eliminate that mezzanine, right? That's one less elevator that someone may encounter is out. We are also working on our elevator maintenance overall, strengthening our policies for third party, which are through private-public partnerships, like the Macy's elevator that was just built right around the corner. That was actually put in by a private partnership where Macy's paid for it. We provided them all of the work that needed to be done in terms of this is the criteria. This saves the MTA money, allows us to put in elevators and make our system faster, and we're looking to leverage these opportunities across the city. We implemented zoning for accessibility 2 years ago, and through that we are also getting public-private partnerships for elevators. And I'm trying to go fast, so I'm sorry. Yeah, I'm trying to go through my list, but try to speak slower.
Take a breath. We're right here with you.
I have 2 minutes to get through all of this.
You have 2.5.
Thank you. Thank you. Through Senator Hoylman, I see a lot of council members here and members of our legislature. Senator Hoylman actually invested in accessibility in his district. He provided us with over $1 million in funding to enhance and accelerate accessibility within his district. So in July of this year, we had made the announcement we will be doing additional work at 11 stations in his district and along the M66 bus route, where we will be installing a new wayfinding technology called NaviLens. And I don't have time to get into it all, but I will be here to answer any questions and share information about this technology. It provides wayfinding for folks. You need to find the bus. It gives you information in real time in terms of elevator status. It gives you real time information about train arrivals. Excuse me, the name of that program? NaviLens. NaviLens.
Lens.
Yeah.
Oh, NaviLens. Thank you.
You're welcome. They've implemented this in Spain and in Paris. They are implementing it. There are other cities across the country that are trying to test, and we are working with all cities across the country. Our team hosts a monthly call to enhance accessibility across the country. So we partner with other, like CTA, for example, Chicago, WMATA, LA, San Francisco, Texas, Seattle, Toronto. We have people from Singapore, Australia, and we all just collectively put our minds together to figure out cool initiatives that are being worked on to enhance and increase accessibility above and beyond the ADA, right? So we know that the work that we have to do to make the system accessible for all is we're going to do that, but we also need to go above and beyond to make sure that information is provided audibly, that information is provided visually, so that we are including all customers with disabilities. That includes if you have a cognitive disability, if you are deaf or are hard of hearing, if you are blind or have low vision, right? Thinking about a one-size-fits-all does not work, right? Accessibility is so unique and disability is unique, and we need to be able to have what we are calling universal designs across all of our modes of transportation. We also have an advisory committee, which is the last thing, and I will wrap up. We have an advisory committee that's called, it's Advisory Committee for Transit Accessibility, where we have 18 members of the community who volunteer and meet with us every quarter, where we talk about enhancing accessibility at the Long Island Railroad, Metro North, and across our subways and buses. Right now, we have 3 vacant seats for our committee, so if we are advising everyone in the community, please share this, have folks apply if they're interested in joining and being a part of the conversation. Our team is very big on including the community in all of the decisions that we do, so we pilot a lot of things, and even with the money that Senator Hoylman gave us, this will be a pilot, a second phase for what we did at J Street Metro Tech right around the corner, where in 2019 we had a accessible station lab of what an accessible station could look like in the future, with additional features like tactile wayfinding, different apps. Specifically, one of the apps that we tested that is also going to be in Senator Hoylman that I did not mention is Magnus Cards, which is specifically for people with cognitive disabilities, and it allows them to be able, teaches them how to use the subway system, from reading signs to purchasing a MetroCard, swiping your MetroCard. What happens if you get lost on the train? How do you find assistance? These are tools that we're trying to implement, but we need to hear from the community before we invest millions of dollars into implementing them. Do they work? Give us the feedback. How can we make it better? Through J Street, we were able to enhance NaviLens to include elevator information, and this second round of what we're calling like a post J Street enhancement for these initiatives, we really want to hear from the community. So we have so many pilots. We have a newsletter that folks can sign up to as well, that we send out every 4 to 6 weeks with MTA-related accessibility information, from station outages, new elevators closing, information about Access-a-Ride, just refreshing some of the Access-a-Ride policies that we have. And lastly, actually I have to say this, I see my friends here at AHRC. We partnered up with AHRC, and we've launched an internship program specific to people with disabilities at the MTA. And what this will provide real job opportunities and as well as job experience for people with disabilities, paid job experience. It's not just administrative, right? We're putting people in engineering. Right now we have 3 interns in real estate. We have an intern on our team who we're trying to hire full-time, and another person already got picked up full-time. So it's opportunities that will lead to full-time work and lead to real job experience. So again, if anyone has a resume, they're interested in applying, I have my business cards, I'm happy to hand them out. Or even if you guys want more information for your organizations to share with them that they can apply through us, please let me know. And we have so much more, but that is all I have time for. Thank you.
Very good. The next organization up will be YAI. Matthew?
Hi, everyone. I'm Matthew. I work with YAI. Like AHRC, we are one of the more well-known nonprofits that work within the intellectual and developmental disabilities community. Of course, we do work under the auspices of OPWDD. So very much so, we are very well versed in how to get OPW eligibility. So our clinicians in our Article 16 clinic, they do comprehensive psychologicals, psychosocials, and autism evaluations. And we're able to really evaluate the person to be able to have them go through the eligibility process. We have a lot of services in home and out of home, such as day habs and supported employment. My colleague Christopher is here with me in the supported employment program. And we also have our Premier Healthcare affiliate, which is we provide medical services, right? And especially we have a specialty dental clinic. We know that people with intellectual and developmental disabilities, sometimes they don't do very well at the dentist, right? So our dentists are trained to work with the intellectual and disabilities population. So come by our table right there and I'll tell you more about our Premier Healthcare Clinic. And so just come by and I'll give you all the information you need. Thank you.
Next organization up is Impact Brooklyn.
My name is Ozzy. Thank you guys for coming. There's a lot of amazing organizations here, many 60 years long, just like ours. Impact is a proud community leading organization that loves to help tenants know their rights and human rights, and primarily equality rights. There's a lot of things that you guys have service to in your community that you might not be educated about, such as financial literacy, also legal aid. A lot of landlords use predatory tactics to take advantage of underserved communities and people who may not look like them. A lot of communities are becoming gentrified, and rent is increasing, and people might not have the right resources to pay for what they need, such as living expenses. So we love to have be that voice in the community where anyone, doesn't matter what you look like, doesn't matter where you come from, could come into our home and get some type of supportive aid to help them relieve their situation, regardless of their income and their social status. Impact Brooklyn thrives in being a great leader in the community, especially in social services, but we really want tenants to know that they have many, many options, and that's why we set up a table here, and we would love for you guys to come stop by. And we're primarily here to let people know about the disability rent increase exception, because Dyer by the New York City State Finance Department. So feel free to come to the table, and Lizzie will give you information on how you can sign up for that. Because if you have any problems paying your rent and you are on disability, you are entitled to freeze your rent and we'll have that information for you over there. So come stop by, and thank you for coming to this awesome event. Thank you.
Very good. Next, we have our main presenter from the Mayor's Office for People with Disabilities. This is the Commissioner of that agency, Christina Curry. Please come forward.
Anyone here hard of hearing or deaf that needs an interpreter? So you need, I can't hear.
Are you watching us? You heard?
Okay. There's a possibility I might change and stop talking and signing because this will hurt my ears eventually. So I'm just letting you know. No. Don't apologize. It's okay. Thank you. I just like to check. Good evening, everyone. Okay, pretend I can hear. Let's say it a little bit louder. Good evening, everyone. Thank you. I appreciate that. I am Commissioner Christina Curry. I've been in this position for all of a year or so. Prior to that, I was the Executive Director for the Harlem Independent Living Center. As you can see, I have a lived experience. I can't hear. I cannot see in my left eye, and I also use the forearm crutch as a mobility device to assist me in walking. So, who am I? Who's MOPD? I am an advocate at heart. As you heard from the Executive Director from the Brooklyn Center, we've worked together in the past in many issues that have an impact on the disability community. At one point, my name in my office was Miss Sue, as in if there was a lawsuit to be had, I was part of it. If someone was not compliant with a law, I made sure they understood what was about to happen if they did not comply with the law. Transitioning into MOPD. I can't do lawsuits anymore. I am now that person that will listen to the community. What are your concerns? And then I take it to the city agencies. That is the charter for MOPD. We are supposed to meet with community members, meet with partner agencies, hear what's going on in the disability community that you like and don't like. I'd really like to know what works, though. Every once in a while, I'd like to hear something good. With what you tell me, or my staff, we then work with the city agencies that might not be in full compliance yet. We're getting there. But we also work with partner agencies who might not be in compliance as well. So that's a nutshell of who we are and what we do. And before I forget, I forgot to say thank you very much for hosting us for Borough President Reynoso, for all the city council members, all elected officials who are here, for all the agencies on the side, and especially for you. Thank you for coming in the cold at night, and if you came by Accessoride, thank you. Sorry, Sarah. So, what's MOPD doing right now? We're doing a little bit of this and a little bit of that. In case you were not listening to the mayor's State of the City and or his press conference and or his town halls, we are working on the initiative, the Employment Initiative Plan, which is to hire or to get hired 2,500 disabled people across the 5 boroughs. We're looking for those who are disabled. And disabled does not mean I broke my finger for a minute. It is those in the community who are permanently disabled. We are here to make sure that people who are disabled will be employed in meaningful jobs, things that they actually qualify for, things that they want to do and can do. So that's the first thing we're doing. Hold on the question, please. So I don't remember much, and if we stop me, we won't be any good. So we're also looking at transportation. Accessoride. I'm sorry.
It's okay.
In case you don't know, I've known Sarah for a while. So Access-A-Ride, let's face it, there are a lot of problems. And we want to hear from the community. We need to hear from the community. When there was the last hearing, city council hearing, I could count how many people were there to discuss what was wrong. So if you don't show up, then MTA thinks everything is fine. We need people to come out in numbers. Joe, we'll be talking about Access-A-Ride and how we can team up. In the meantime, we're trying to gather information on what's happening in the community for those who do take Access-A-Ride, but also, why don't you take Access-A-Ride? Why are you avoiding it? Or does it work for you? We need to know. The other thing that we're looking at is digital accessibility. If you want to apply for a job, you should have the same access on the website as those who do not have a vision loss. Remember I said I'm legally blind. Trying to navigate a website sometimes is torturous to the point where I don't feel like doing it. We know there's a federal law that says you must have your websites accessible. So that's what we're working on. And not only a federal law, we're looking at city mandates as well. Emergency preparedness. If any of you know me, you know that that's what I've worked on since 9/11, the day after 9/11. I have worked with FEMA, I have worked with OEM, I've worked with the community. Emergency management is important to our community. Why? They don't know about us. They don't remember us. It's nothing about us without us. You do not. Who said what? Thank you. I do not want to be told, wait in the stairwell and we'll come get you. No, that's not acceptable. We're not doing that. I do not want to be told, oh, shelter in place, but you don't know that I'm here. If you're building, if you're in a commercial building, if you're in a project, if you're in a big community of apartment buildings, what's the plan that they have for you? Does anyone know? We need to change that. We need to make sure that FDNY knows we exist. Don't say afterwards, oops, sorry, my bad, so sad. No, we're not doing that. So emergency management to me is extremely important. I want to know, if you live in a building that doesn't have an alarm system, then how would you know if FDNY is in your building? And even if they do have an alarm, if you're deaf, how would you know? You're supposed to look out the window and see a whole bunch of fire trucks and go, okay, now what do I do? Do I stay? Do I go? How many of you know if you live in a fireproof building or not? That's important. Okay? Very few people raise their hands on that. I know. That's the first thing I know. I have relatives who worked in FDNY, so I always look. Do you know where your exits are? Have you practiced fire drills in the place where you work, where you live? Or do they always say, well, won't you have someone with you to help you? Really? Really? We're New Yorkers. So most of the time we're independent, or we want to be as independent as possible, which means we might not have that elusive assistant or aide or can't afford it. Or we don't need it to that extent. But if others don't think about us, then we are placed in the acceptable loss category. I don't know about you, but I'm not ready for that yet. So emergency management, I talk about it a lot on what we need to do, because we also need to be responsible and take ownership. This is our lives. So we need to be there at every meeting, the community meetings, NYPD meetings, FDNY, and say, hello, I exist. What's your plan of action for me and those like me in the event of a catastrophic event? The flooding, the storm. Hello, did they remember us? So therefore, we need to be there. We need to remind them. One of the other things we were looking at is, I keep talking about we have to be there, public outreach. I need you involved. I need to hear from you, preferably without you cursing me out about what's not going well. Be nice to me, okay? Be nice to my staff. But let us know what you need. If you don't tell us, then we become the same as the other agencies. We decide for you. And that's not correct and it's not right, because I'm going to keep saying it. Nothing about us without us. I came from the advocacy world. Independent living centers. You don't decide for us. But if you don't show up, if you don't contact us, if you don't let MOPD know what you need, now we're starting to guess. And when you're guessing, you're probably going to get it wrong. I can look at it from the perspective of my needs, but that's not the same as someone who uses a wheelchair. It's not the same as someone who's fully blind. It's not the same as someone who is ASL dependent, fully deaf. Different needs. But if you don't let us know, there's nothing that I can do. And I'm not saying every time you tell me that I will be able to get the other agencies to listen, but at least I know. And I can bring it up in every conversation with the appropriate agencies. The other thing, let's see, education. I know for the hard of hearing community, they've asked repeatedly to have the screenings put back, hearing screenings back in the schools. I'm working on it. I've only been here for a year, so give me another year. Let's see what happens. But I'm working on it. For health, we've been doing a lot of working with hospitals in talking to the doctors, especially when you come out of med school, get them while they're young, about, you know what, we need access. The worst thing that's ever happened is when I've gone to the doctor and they ask the question if you have children, and I say yes, and I've had doctors look at me and say, how? Then I have to say, well, let me explain the birds and the bees to you so you understand this. But the fact that they don't see us as whole individuals. So we're doing trainings on, you need to remember who we are. They are taught how to treat a disease or a medical issue, but then they don't know what to do with us when we're disabled, when we fit or do not fit in the norm of what they know. So we need to say, that's not acceptable. When they talk about the mortality rate of black women who are pregnant, that's not acceptable for it to be so high. It's not acceptable if you're going for a mammogram and you can't get one because the exam table is not accessible, or the mammogram machine itself is not accessible. I had one nurse ask me, well, can't you just stand like this, and do your knees hurt that badly that we can't place you? Like, you place it like that, you're hurting me. You don't know if I have brittle bone syndrome, whatever. You don't know if I have arthritis, but to be so insensitive, that's a no. How many exam tables are accessible? I'll wait. Okay. Right. At the Harlem Independent Living Center, and I don't work there anymore, so this isn't like a plug because I get paid, but Harlem Independent Living Center had teamed up with another agency called Pillars, where they brought in doctors from Toro College, and they brought in an accessible exam table so people in the community of Northern Manhattan could get an actual exam. I had a colleague who had never had an actual physical exam because the exam table did not go down so that she can transfer in from her wheelchair. Imagine that. You go to the doctor's office and you can't get an exam because the table's not accessible. So we're working on that. We're working on sensitivity because the next doctor that calls me mute, we're not doing that. And by the way, if you don't understand, mute means the inability to produce sound. I think I've shown or proven that that's not true for me, right? Just because you're deaf does not mean you cannot voice. But people, medical professionals, believe if you can't hear, you can't speak. And if you do, oh my God, look at the miracle. No. We are capable of doing the same job as someone who's non-disabled. We do it differently, but we can still get it done. And that's why I'm here, to show, as someone who's disabled, we can get it done. We do it a different way, but we can do the job. But I also need all of you to work with me on that. One of the things that MOPD has been doing is partnering with other city agencies. Sir, we just started working with the Department of Veteran Services, Commissioner James Hendon. If you ever have an issue, please reach out to him. He's a great guy to know.
If he ever calls back.
Okay, well, I'm going to say
You hear
this.
what I just said? If he ever calls back.
Okay, well, hold
I
on.
called him a month ago, still waiting for a call back.
Okay, well, if you were today, this is Veterans Month, and he just had a symposium yesterday.
I'm an advocate for disabled vets.
Okay, so give him a break, give him a minute, because they do return calls, okay?
Really?
But just like my office, where I don't always return calls, one, I can't hear. So, no, we're not going to get into it this.
Just give me his direct number.
I don't use the phone, so I can only give you email addresses.
I know, I can't use a computer. I can't
Okay.
use a phone like that.
So let's talk offline, please, okay? But I wanted you to know that service is available.
Okay.
We're also partnering with Office of Emergency Management, with the school system. We are with Health and Hospital Services. Basically, just about every city agency that works with the general public, we're working with them too, to make sure that they're inclusive of all of us, for us. Any flyer that goes out needs to let you know that it's accessible, so that you feel welcome. There's sites where they're holding or hosting events. If it's not accessible, then they shouldn't have it at that spot. No one should have to feel that they're not welcome. No one should have to look at an entrance and say, one step. To you, that's easy. To me, it's like climbing Mount Everest. All events should be hosted in accessible locations, always. How much time do I have left? Okay, sorry. Okay, thank you. Remember you said that. So we're also working on building code waivers. Understand, there are some buildings in New York City that you will not be able to make accessible based on current technology that we have. Doesn't mean that we won't review it, but there are some that cannot, especially if you're in Manhattan, northern Manhattan, that's on a hill, some parts of Brooklyn. You can't do it. That's not an excuse, as in, oh, so sorry. It is what it is. But we still check it out. And if, in fact, you cannot make it accessible at all, that's when we look at a waiver on why it's not accessible. The other thing that we're working on, I mentioned health, I mentioned building codes. Culture and nightlife. Don't you want to go to a Broadway show like everybody else? Wouldn't you like for it to be accessible? If you're hard of hearing, wouldn't you like to be able to use that tablet that's captioned without worrying about the artist being upset thinking you're on the phone? If you're in a wheelchair, wouldn't you like to be able to see the whole production and not be placed off in the side, in the back, in the corner, in the dark? Wouldn't you like to be up front with everyone else? I would. And if you don't use a wheelchair, but you're like me where I have trouble with my legs and you feel like your knees are all up in your chest because the space is so small, don't you want access? You gotta let me know. But we're working on that. We're working on movies that should have some type of captioning. If you're in a Broadway play or musical, to make sure that you have the interpreter that's requested. That is your right. That is your right. Everyone talks about ADA. ADA is one component. ADAG is the law that actually has an impact on the buildings. So when people say, oh, it's ADA compliant, we're not talking about the inside of the building. The outside is where ADAG comes in. And then there are a whole bunch of other laws that apply as well. I'm talking fast to make sure I get everything in there. I think that's pretty much it for right now. We talked about transportation. Yeah, so bottom line, if it has an impact on your life, then it has meaning to me and to MOPD, and what can we do? And again, we might not be able to make an impact or a change right away, But once we start talking to the other agencies and they know they're now being watched, it then moves the needle, as they like to say at City Hall. We're going to move the needle a little bit. We're going to budget over that way. So, thank you for your time. I hope I was able to clear some things up. I'll be here if you have any questions. Thank you.
Yeah, actually, I have two questions and one comment. Question number one, you said that your office planning to make sure that to give the job as many like 2,500 disability people. That's my question, which I learned. A lot of disability people afraid to have a job because they're afraid to lose benefits like Medicaid or some kind of welfare they have. For example, here we have Victoria Garevic, who is a director of Para Arts Foundation. She would like to help and support artists with disability and make sure that they sell the arts. And she learned that the artist even doesn't know how to sell it and they're afraid to sell it because they're afraid to lose the benefits. So how this, your plan correlates with benefits the disability community has?
Okay, thank you. That's question number one. First, my mistake. What my responsibility for MOPD is to assist the 2,500 disabled people in finding jobs. So MOPD is not hiring all 2,500. We don't have that bandwidth. But we're looking to make sure that 2,500 disabled people are with appropriate agencies to assist them in being hired. So thank you for making sure I was clear on that. The next thing, first I'm going to say something hard. That's up to that person. If they're receiving benefits, they need to weigh the benefits for themselves. They can start off as working part-time so that it doesn't put them over the monetary limit of receiving benefits. And then once they start working, they may decide, okay, I want to move out of getting benefits and go full-time, get insurance through that company, and so forth. But that's an individual decision. Okay, I have the interpreter. So the other person has another question. Or no?
Okay, 1 second.
Let me go.
There's a statement from AHRC NYC about employment, and then I'll take the next question from the audience.
Hi, I'm really sorry to interrupt you. I just wanted to say something about employment benefits for people with disabilities, right? So there's SSI, SSDI. I know a lot of people in this room are familiar with those things, right? Now, yes, you can get your benefits, but you can also work. And while it will absolutely change the amount of benefits that you receive, if you get benefits counseling and you report your wages properly to the Social Security office, you can still get both at the same time. And a lot of times, often, especially because a lot of folks with disabilities can't work a full-time schedule, they do get like more money, right? If you do the math. They get their cash from their job, their paycheck, and then their benefits. Now, it varies on household information and all that, so I can't tell anybody specifically what you're gonna get, but that is not actually true, and a lot of parents and families often believe my child or my son or daughter, my family member cannot work because I'm gonna lose my benefits, they're gonna lose their benefits. It's not that you lose it. The amount is adjusted to accommodate for the income that you're receiving. So they don't go away, they just recalculate, and oftentimes people end up making more money than they would just on benefits. I work with supportive employment for people with developmental disabilities. I know there's somebody else here from YAI that also can speak to that, and I know that HRC offers benefit counseling and information in our supportive employment department. So if you have an intellectual developmental disability and are getting supportive employment services, this is part of the service. We teach people how to report their wages and how it works and how you don't lose your benefits entirely. You lose the benefits when you don't report the wages. That's what happens. So you must report the wages and get the benefits counseling. For those who do not have an intellectual developmental disability, I don't know who provides that benefit counseling, but I'm absolutely sure that it's available at some of these other agencies.
Very good, thank you. Next question?
I thought,
I'll come over here.
wait, did the person who was in the back said they had 2 questions? Did they answer? Okay, ask it while you have the opportunity.
Okay, yes.
Can you wait for the microphone? No, I know, but some people can't hear you without a microphone. Thank you.
So I have also one comment because you mentioned accessibility, Access-a-Ride. Because I'm here, I just would like to tell why, like my mother, she is legally blind. And why Access-a-Ride was a nightmare for her, it was 2 reasons. First of all, when we make order for Access-a-Ride, it was always constantly late from 1 to 2 hours. However, when they were coming earlier, they wait only 2-3 minutes and they were leaving. So that's what was the reason why we couldn't use her benefits.
We have platforms for folks to come and tell us their issues. Just this past Monday to last Monday, the vice president of Access-a-Ride.
Could you be quiet over there? We can't hear.
The vice president of Access-a-Ride presented his vision of Access-a-Ride and the enhancements that he's going to do to Access-a-Ride, for Access-a-Ride. And through our advisory committee, we only had about 40 people show up, right? So there are platforms for folks to show up, for us to hear from folks. We hear from the same group of people, their problems, and we work with them to address it, right? So, for example, that taxi reimbursement, we worked with our advisory committee to change that policy. Right now, we're looking at it to try to do interborough, because you only can go from Brooklyn to Brooklyn. We're trying to look at Brooklyn, Manhattan, Queens, Manhattan, outside of that, right? And in terms of pickup windows, right, the pickup window, the late window used to be over 30 minutes. Now, through working with advocates, we've lessened that, and we're working on it now again, where it's going to be dropped to a 20-minute window. When it does not show up in 20 minutes, call Access-a-Ride. They'll either send you an emergency rescue vehicle, or they will give you a taxi reimbursement authorization so you can go on your way. Right? So we're trying to change the processes, and we're trying to change the policies, but without hearing from the communities, it's hard. Like I said, our team really can't do anything without hearing from the community. We don't want to, because it's important that you guys are represented, right? Like Christina said, nothing without the disability community, without you guys being present. And that is very important to our team. That's why we have these open meetings for our advisory committee where folks can come. And we also share information about, for example, Access-a-Ride, right? We also share information about buses, about our capital plan, about how we're investing in the system. How do we make the system accessible? How do we enhance Access-a-Ride? There's a lot that's happening on the back end right now to make Access-a-Ride better. It's not perfect, we know that. There's a lot of work that needs to be done, but the new vice president is committed. And I've worked with other folks at Access-a-Ride. His vision aligns exactly with the community. He's an Access-a-Ride user. Chris, he is an Access-a-Ride user, has used Access-a-Ride for years, has sued us on Access-a-Ride. So he's aware of the issues that we're facing. And again, come to the table, speak to us, file those complaints. When you have that issue, call Access-a-Ride's complaint number. We look at the data, right? And a lot of people think we don't do anything. We look at that data to enhance systems, to figure out what stations need to be made accessible based on what we're hearing from customers, right? How do we make Access-a-Ride better? What do our customers need? It's really hard when we don't hear from people. Access-a-Ride, we have surveys that we give out. And I can tell you, we have over 60,000 people using Access-a-Ride. On average, we're scheduling over 20,000 trips a day. We only hear from like 1,000 or 2,000 people, right? So we can't make major policy changes based on what 1,000 people are telling us, right? We want to base it for everyone. Collectively, we have over 100,000 Access-a-Ride users, and we only hear from 1%. It's hard to make changes, right? So file those complaints, please.
I have to go downstairs. I have to go downstairs because of Access-a-Ride. I want to ask some questions. It's very important. I want to ask you. Okay.
I want to say that what you said was good and understandable. But you got to understand administration, how they work sometimes when you call them. When I get a what they call a rescue, they don't send me the vehicle that I need. They usually send me a little small car that I can't get into. Okay? And they try to force me to take that. If they don't, I get a no-show. Okay?
So let us know, right?
Yeah,
That
listen,
can't happen.
my complaints are this thick. It's almost like someone who's in jail. Okay? When I call and I get responses from the complaints, but they don't tell me what they're doing to rectify it. Okay?
So I know we've changed our no-show policy based on what you're saying, right? And also, sorry, I want to come back to the front. That's my card. Reach out to me. I respond to everybody. People, Commissioner Curry, I respond to people. I will take time to meet with folks. We do ride-alongs. You know, our team is truly committed to enhancing accessibility, but I want to work with the community. We have to do it hand in hand.
Okay, let me go before they leave.
Coming over here, if someone has a question. Please say your name, the agency you're directing it to, and the question. Not a statement, but a question. I'll hold the mic.
Hi, Sarah. At MTA Accessory. How do I get on that committee that they said there's openings at?
So the committee oversees transit accessibility. Accessoride is a part of it. I can give you my email. It's also listed on our website.
It'd be much easier if you give me a call.
Yep, no worries.
Because I'm with Disabled in Action. I don't know if you know about DIA.
Yes, Jessica Murray was our chair for ACTA, and she is stepping down now, so we have a vacant
So I'm
chair
second
position.
vice president of public affairs. So I want to get involved because I use Accessoride.
Absolutely.
And you can imagine. So I would love to be on that committee.
Beautiful. So if you guys go to new.mta.info, the MTA's website, under accessibility, which is what our team constantly updates, everything accessibility related at the MTA is there. And there's information on how to apply, but email me and I can send you that direct link as well.
I appreciate it,
Okay,
yeah.
you're welcome.
Because don't ask. I have people get in the cars, and a woman had a bad leg, and she's complaining that she can't get in these cars. And when they call, she said it's like terrible, they don't want to do nothing.
And Chris's vision for Accessoride is to overhaul all of that. From the call process. When you call, it should not take 30 minutes for you to book your ride. We are aware of that.
I don't need to speak to yourself. When you're booking, and that 5 o'clock thing drives me nuts. Because I was trying to book something today at 4:55 online, and it wouldn't take. And I lost getting a trip tomorrow because of it. You have to do something with that. You can't, everything has to be 5 p.m. You know what I'm saying? It should be up until midnight. There's no excuse for that. Some have to change with their reservation system.
You are right, and we are investing in a new system. In May of this year, we actually had invested millions of dollars for a new scheduling system through a company that I will not name, but you guys can Google. And we had to sever ties with them because they were not delivering that system fast enough. So now we are working with Uber, we're working with Lyft, we're trying to figure out different systems that will work. We hear you.
That 5 p.m. drives me nuts.
And that is one of the vice presidents for Accessoride's initiatives as well, to try to change and figure out a new system. Yep.
I couldn't get a trip tomorrow.
Okay, we have the next question. Say your name, the question, and who you're directing it to. I'll hold the mic. I'll hold the mic.
Okay. It's directed to you.
Okay, me.
You want this chair?
No, I'm good.
Accessoride with veterans, they take Accessoride also. And they're always late for appointments. There's a reason for it. When you have a city that only goes 25 miles an hour, you're not going to get there on time. We have a problem with the speed limit. That's why taxis don't get there on time. Nobody gets anywhere on time anymore.
So what we're doing specifically for Accessoride is we've allowed our Accessoride vehicles to drive on our bus lanes, right? So that you get to where you get to faster, so that they're not stuck in traffic.
Even the buses don't go in the bus lanes.
Well, our Accessoride vehicles go in, it is something that we're aware of. That's a DOT issue. I know Vision 20 is something that is very, very big in the city and has saved lives and is important. But also understanding, again, where our scheduling system will come in is it will help us identify faster routes and will take into account real traffic times.
Because we have veterans that they miss their appointments.
I have the next question.
Thank
Your
you.
name, you're welcome. Your name, the agency you're directing it to, and the question.
It's me?
Yes.
So my name is Rashida. So this question is for Commissioner Curry. It's two questions. So first of all, I definitely appreciate your presentation. And so my two questions are, for the 2,500 city jobs, how would a person find out about these positions? Would they go to NYC at work? What is the process? And the next question is, we hear a lot of complaints from the disability community that MOP does nothing. So if they were to call, what would you say is the turnaround for people to expect for change?
Hi, Rashida. How are you?
I'm here.
Okay, let's answer the second question first. I just got here, okay? I can't account for what was done before with MOPD. I can only talk about what we're doing now. And people had unrealistic expectations of MOPD because no one knew what MOPD could do and was supposed to do. Our charter is, first and foremost, we have to hear what the community is saying, and then we take it back to the city agencies that they're having issues with. That was the first thing, but that was never done. Prior to that, it was a different administration, and they might not have listened. I don't know. I can't speak to that, and I'm not going to try. All I can say is while I am here, give me the opportunity to make a change. Rashida, you've been part of the meetings that we've had.
Yes.
So we're trying. We're definitely trying to make an improvement. What's the turnaround? I don't know, because no one calls us. I don't use the phone. I'm email, okay, because I can't hear. So if you email me, I will respond. But it depends. If someone's saying, well, I'm having a problem with health and hospitals. Well, I don't work for them. So all I can do is take what's going on, take that to them, make very strong suggestions, and if it's something that needs to be escalated up, then we will. So that's the first thing. In the first year that I was commissioner, all the targets that we were supposed to hit, we hit all of them. We did what we said we were going to do. The next thing is, when you talk about the 2,500 disabled people, it's not just city jobs. We're looking at nonprofit. We're looking at private organizations. It's to get 2,500 disabled people employed in real jobs. So it's not just the city, it's everywhere. And that's through 55A if you're looking for a city job. It's NYC at Work. It's a new state initiative called the Scion Project. So we are looking to work extensively with everyone. We're going to reach out to MTA and say, hey, what do you got? You know, it's real jobs. You go to a job fair and then you come up and they're not offering jobs. They're just taking your resume for the heck of it. We're not doing that. We had an expo where the mayor was there during the summer where we had different job fairs where people were offered jobs on the spot, right then and there. But you had to qualify. And we also need you, the general public, to bring an actual resume. We had people show up without resumes, or resumes that didn't make sense. You can't just put half a name there. We need to be able to contact you. You can't put, you know, CDD at 123 and say that's your email contact, really? Okay, you have to also show up in an appropriate manner. So it's also, the responsibility is also on the community to work with us. So on that, how fast will that be? Well, it depends on the job providers that we invite. Anyone who's invited to attend our job fairs and so forth, they must have actual jobs. This is not a hunting session, a fish session. You must have jobs. Now with that, here's my little qualifier. If you've been reading the news or watching the news, we've got a little thing called a hiring freeze right now. So that turnaround is gonna take a minute, okay? But we're working on the back end so that when that hiring freeze is lifted, we hit the ground running. And Rashida, you have my contact information. So if there's something that's not right, contact me.
Do you know how many, or if there are plans for any of these jobs of disabled to be in the Office of Emergency Preparedness?
Well, I can bring that to the commissioner and ask him. But again, since it's city jobs, we're looking to talk to all the agencies. And prior to this hiring freeze, we had, I believe, 12,000 jobs that were open within the city. Don't quote me on the exact number, but it was high. Okay?
I have one more, another question over here. Is it your name and who it's directed to? I'll hold the mic.
My name is Diane, and I'm director at MTA. I'm part of this new, well, it's not new, the pilot program, which they just changed it recently. And it's really
2017, we rolled out an e-hail pilot where it allowed 1,200 users to access same-day services through taxi. So they had an app. You just upload your address. Like, for example, if you wanted to leave right now, she could do it on her phone, and the taxi would be outside. You don't need to do the 2 days in advance reservation. With those 1,200 users, we found a lot of errors with the data and a lot of discrepancy in terms of being able to provide accurate numbers to be able to roll this out on a larger scale to all of our accessorized riders. What we found is we need to have a control. That is why phase 2 happened, and what phase 2 did was it looked at what other cities were doing, because the e-hail pilot is in addition to the accessoride, right? So it's not supposed to replace your traditional accessoride service, right? So you still have your regular accessoride service. So you can use both, and we recommend to use both, right? Because, for example, if you have to go to work every Monday at 9, and you know you have to go to work every Monday at 9, you can schedule a scheduled pickup so that automatically every Monday at 9, you will get to where you need to go. That's scheduled, pre-scheduled, or 2 days in advance if you are going out with a friend and 2 days in advance. But sometimes when things happen where you need to go in that moment, that's why e-hail was created. So submit that feedback, because we are going to be reevaluating again after we get all of the phase 2, 2,400, the 1,200 additional folks in phase 2. But it's important that we hear from you. Let us know that it's not working for you, right? We want to hear. Based on the data that we're seeing, it does not match what we're being told. That's why we need to hear from customers, right? We are having challenges finding 1,200 additional users to apply to this program. We've reached out to over 10,000 accessoride customers, and we have not had the 1,200 users sign up. And it has to be random, and eventually, when we can know we can't get 1,200, then we're going to have to open it up to see who is interested.
We have a question here. 1 second. Your name? She's directing it to you.
Hi, my name is Evelyn Castillo. I have a question regarding the e-hail program that you were speaking about. To my understanding, this program is going to end in February?
No, that's not true. Phase 2, we are going to be evaluating phase 2 up until February, and that might be extended a little bit, given that we are having a little challenge finding 1,200 people. But there's no, what I can tell you based on what our internal conversations are, there's no plans to kill the program. From our internal conversations, that's not a conversation that's ever come up at the table.
It's come
So
to
I don't
my
know where you
attention
heard that from.
Because I've been to the MTA meetings, and I've also have a petition out regarding the e-hail program of changes that need to be made, because not everybody can afford that. There are people that come here to work, and they have to use that program, and the prices are astronomical because they change all the time, whatever, the peak hours. My thing is that they said, okay, it's a pilot program. Their response to me was, it's supposed to be a pilot program. It's not supposed to be an ongoing thing. What changes are going to be done to accommodate people with disabilities that are on fixed incomes?
So that's why we're running the pilot now, where we have a random sample to compare to the initial 1,200 that we have and that random sample so that we can clearly identify the areas and put in that complaint, put in these things. And if you have, I'll give you my card, send it to me, I'll send it right up to the vice president. Like, we are connected and we connect similar to what Commissioner Curry does, because MOPD does come to us, hey, there's this problem, please address it with the customer, and we will respond directly to the customer. And it's important that you reach out first off to MOPD, so MOPD can reach out to us, reach out to me so that I can forward it, right? And that your feedback is heard. It's important that you utilize other agencies that we work with as well. Like MOPD is a very strong partner that we work with and helps push things along as well.
Another thing is you said about the 1,200 other people you were trying to get. There's a lot of people that I know that they want to be part of the program, but when they call accessibility department to see what they need to do, and they're told, no, it's random. And there's so many people that want to be a part of it, but however, they're being turned away. So what can be done to help those people that want to be a part of the eHealth program at this time?
So have them send me their names. What we're doing now is we're just going to keep a list of folks, and if we can't get those 1,200 spots filled, I forgot the date that the vice president said, send it to me. And also, one thing I forgot to mention is we're always looking for people to talk to and test things with. So before we implement things, we want to test it. Accessorite just did a demo for their new vehicle for the Q strains, and only like 4 people showed up to test out the new vehicle.
How do you get this information?
Through Accessoride, contact me, I'll add you guys to our list. We have lists. If you go on new.mta.info, ways to contact us, it's all there. Sending emails to our team directly, accessibility@mthq.org. It's also listed on our site. And I can share these resources with you. And that's another thing, right? If you guys have ideas for us on being able to share resources more with customers, that's something that I am struggling with. We reach out to organizations, but something that we really want and need to be able to share resources. So even if we send you guys stuff, blast it to everyone.
Before we ask another question, hi, this is Commissioner Curry. Real fast, real fast, because I know it's time for us to end soon. The mayor has town halls in every borough, and he's going from area to area. So if you live in Corona, Queens, if you're in Brighton Beach, and I apologize, I don't know Brooklyn well, but he's going from area to area. Show up to the town halls. That's important, because a lot of the questions you've had, the other agencies that you need to talk to, they're there. Because right now, all I can say is, I refer it to them. I can refer it to them. But at the town halls, you can ask that question directly to them, so that you don't have me in the middle. Because it's frustrating after a while for me to say, I'll refer it to them, I don't know, as opposed to, you can talk to them. Now, if they say they don't know, well, you know what I mean? But come to the town halls. He's going to be in Brooklyn. I've been in Brooklyn more times in 3 months than I have my entire life. So I'm getting to know. By the way, I do like the food here. But go to the town halls. I can't stress that enough. Please. And we do work with the MTA. They get a lot of email from me saying, do this, do that. And why is it important to let me know, or my staff? Because then we track it. We do track it, and we do follow up. Thank you.
All right. So that's it for the night. We thank everyone. We thank Commissioner Curry very much for your very extensive presentation. We thank all our partners and elected officials. Thank you everyone for coming, and good evening. I have the cards for MTA in my hand.